To be respectful of everybody's time, I am going to go ahead and jump in and get started here. Um, First of all, I want to thank everybody for jumping on today. I will definitely not take the whole hour, and I hope I've got some help from Reagan from our marketing team. She's going to make sure to unmute anybody, and if anybody's got any questions, go ahead and raise your hand, and would love to have this be a conversation as much as a presentation. At a high level, just kind of want to talk real quick. We've got some clients of Lutz who are on listening to this, and some non-clients. So just kind of want to welcome both of you. But at a high level, kind of want to introduce who Lutz is and who I am in particular. So I'm Scott Kroger. I'm a shareholder of Lutz. Lutz is a 300-person professional services firm located in Omaha, Nebraska. We have a number of different business lines. Started off as an accounting firm in 1980. But about 25 years ago, got into technology. And so our technology practice is a 70-person division within Lutz. And we've got a strong relationship with Microsoft, which is one of the reasons why they have asked us through our partnerships with Microsoft to really make sure that we get the word out about this program that was announced over the summer. So I'm a technology partner at Lutz. Computer science major and I don't know if John has joined, but I was a computer science major at DePauw University in Greencastle, Indiana, Putnam County Hospital. I drove past a number of times. I had a couple fraternity brothers who had to actually go to the hospital. Probably won't get into that during this presentation, but excited to have you guys on. Lutz Network. So as I mentioned, again, a professional services firm. I just kind of wanted to kind of give a breadth of, the scope of services that we provide. Accounting, consulting. We have a financial division, a talent division. But the things that are most relevant to the people on this call would be the accounting division. We do have a specific division, and Paul Baumert has joined me. Paul runs and heads up that division. So Paul and his team work with over 100 rural and critical access hospitals across the country, primarily providing CFO and controller level services where necessary. And so Paul and his clients, he's reached out to his clients to make sure that we get the word out about Microsoft's offer, as well as how to claim that offer, which is not exactly the easiest thing in the world to do, which is what we'll get into here in a minute. So, okay, again, Lutz Tech, 70 employees. We do a couple things, but the two biggest things we do are outsourced IT, where we either become or augment the IT department for the businesses that we serve. So in some cases, if it's a 50-person law firm, we're the only IT resource for that firm. If it's a 250-person company that has an IT department and they just need some help with certain functions, then we come in and provide some of those functions that allow the internal team to focus on what they're best at. We also have a data analytics division where we get in and help clients stand up large data warehouses, data lakes, and primarily leverage Microsoft's Power BI functionality to create reports, dashboards, and get access to information that was previously in disparate systems, but putting that together. I think the big thing that we try to do, being from the Midwest, I think a lot of technology people are guilty of a lot of buzzwords and trying to sound smart. I think the one thing that we really try to do is use analogies, make the complex simple, and that if there is a differentiator of what we do, it's that level of approach. Okay, so why are we here? This specific topic today is the challenge that every business is facing, but in particular, hospitals and rural and critical access hospitals. The challenge that they're facing is that there has been a massive increase in the bad guys attempting to get access to data And what we've seen is a large increase in ransomware attacks, since 2023. So at approximately 130% increase year over year in cyber attacks. Most of the attacks have a financial motive. The interesting thing is that a lot of those small to mid-sized hospitals had to suspend operations in the past 6 months, it really is terrifying to everybody because that is the lifeblood of the communities that you serve. And when the bad guys get in, sometimes weaknesses are exposed as far as backups and ability to recover quickly. And that's why it's definitely a critical infrastructure, and why the White House got involved with Microsoft to help provide assistance from a security perspective, as well as make more hospitals nonprofit, give them nonprofit status, which we'll get into in a minute. The average cost or a cyber attack is expensive, and it's typically down for an extended period of time, which again is very, very disruptive to the communities that the hospitals serve. So in June of this year, the White House, Microsoft, and a couple of other health organizations basically said, okay, we're going to try to fight cyber criminals attacking rural hospitals. And Microsoft came to the table and said, okay, here's what we're going to do to help with that. And so there's been a bunch of documentation produced. I've tried to distill it down to 5 things, which we can talk in detail about. The biggest one being the discounts. So historically, Microsoft has stated that hospitals of any kind don't qualify for their nonprofit pricing. Typically, the pricing has been only for 501c3s. Some of the hospitals that we've helped out with have found a couple ways around this by taking some of their foundations, the hospital foundations, which are 501c3s, and trying to add licenses to those 501c3s. That's been hit or miss as to how well that's worked. So the good news is everybody on this call does qualify for this, and that was one of the reasons why we had reached out to you specifically to say, well, you do qualify, and we'll get into what those benefits are of now that you qualify as a nonprofit, what those benefits are from Microsoft for a number of different. So again, everybody qualifies for one on this call. Well, everybody qualifies for the rest of these as well. So 2 through 5 as well. But so free security licenses for a year. There are a couple of Microsoft SKUs that we'll get into detail on that provide you the ability to have that extended security. And for those that want more detail, I've kind of got a detailed comparison of those features once we get into those. That is kind of more of a geeky conversation. I'll save, but ultimately it's up to 250 licenses of 2 higher end Microsoft security SKUs that we would recommend implementing. Number 3 is Windows 10 support extension. So hopefully you've all started to look into Windows 10 expiration, Windows 10 license support. Windows 10 support from Microsoft will end a year from October. So about October 14th or so. We'll get to that slide in a minute. But that support for that operating system will go end of life. The good news with this is that Microsoft is saying, hey, for hospitals, we'll extend that for a year for free, so that if budget-wise you're not able to get around to upgrading those operating systems in time, you're going to have an extended period of time to upgrade those operating systems if that's something you're not able to get to. Number 4 is assessments. So Microsoft does have a couple of partners, Tech, Impact, and FSI Strategies, to do a cyber risk assessment with the hospital environment. I will tell you that those are not, if you're used to bringing in security providers to do sort of detailed penetration tests and some of those higher end security assessments, this is not that. From what we've seen, these are more questionnaires that are facilitated by these organizations to help you make sure they understand where you're at from a security posture perspective. If you've done a cybersecurity insurance, if a cyber insurance questionnaire recently, those are probably just as detailed as what we've seen from these assessments, but nonetheless, those are available to you as well. training that is specifically geared towards the staff, but also for the technology staff within those hospitals are available as well to provide training for those hospitals. I'm gonna stop there, and if anybody's got any questions or wants to raise your hand with what I've already talked about, and I don't know, is it just Jonathan and Brandon that are on? No, we have some more. Oh, great. Okay. So if anybody has any questions at this point, go ahead and raise your hand and jump in. I think, is everybody unmuted at this point? Okay. Just pause here for a little bit. Okay. Hi, Joy.
Hi. I had a question. So we tried to apply for the discount. We're in an unusual situation, so we're a 501(c)(3), Powell Valley Healthcare. We're also instrumentality of a district, and they said because of that, we did not qualify.
Okay. That's where we can help. This has been a very common thing. So we've helped 3 health systems so far. All of them have the same story. It involves us going back to our partner, really pushing through the request. We do have sort of a direct line to specifically the nonprofit sector within Microsoft. That's the version that's helped us push that through. So Joy, we'll connect after this if I can get a little bit of information, and I'll just reach out to our Microsoft partner, specifically the nonprofit sector, and say, hey, here's somebody who is trying to get qualified, who is not qualified. Sadly, your story is not unique, but there are ways that we can help. So I
Okay.
appreciate you asking that question.
Thank you.
Hi, I have a question. So we looked into this a little bit with the discounts. We're a critical access hospital, independent, and we were told that if we bought an E5 through this program, the discount was only good for 1 year. Is that true?
Unfortunately, that is correct.
Okay.
So as it stands right now, it is you get the 250 for free, and then all the documentation that I've seen says that, hey, we're going to encourage the hospitals to actually pay for that after that year. So the hope is that that changes. I think there's a couple of things that we've gone back to Microsoft and provided them, at least through our partnership, and provided this feedback to say, first of all, in a lot of cases, these licenses don't necessarily move the needle because it's not free forever. We have it for 1 year, and now we're gonna have to budget for it the next year. I will say that everybody on this call who is now qualifying for nonprofit pricing, and we'll get into this in a minute, that is a meaningful change depending from a cost savings perspective. But was that Julie? Kristen. Yeah, Kristen, that's a concern that, especially with those security licenses, that no, it's 250. First of all, a lot of hospitals have more than that, so it makes somewhat of a dent. But that's a piece of feedback that we're giving back to say, well, that's great, but it's not enough. And that's typically been the message that we've been sending back through is that this is all great, but especially in the case of these security licenses, it's not enough. So the answer to your question is yes, unfortunately, you've read that right. It is a year only, but there is an effort, on behalf of us representing these hospitals to say it's just not enough. Great question.
Thank you.
Joy, did you have another question with the hand raise?
Nope, I just didn't take my hand down.
Okay. Arm's getting tired. Okay.
Not enough coffee.
Got it. Okay, so just jumping back in here real quick. Yeah, so the qualifying hospitals, again, I've given this presentation to hospital systems that don't know if they qualify, and it was kind of a mixed audience. Again, everybody on this call qualifies, so must be a rural hospital, must be critical access or rural emergency, and must be independent, not affiliated with a larger health system. So those are the qualifications. But again, everybody on this call does qualify. Gonna jump into the details of some of the SKUs, and what the value is. So, and this is for all nonprofits. So a lot of the 501(c)(3)s that we support in our managed services practice do qualify for this. And so there in some cases there is a max number of licenses. But if you're paying for Microsoft Business Premium, which that product is in and of itself a very good value with the number of features that come with that. But having that significant discount of a $22 product for $550, maxing out at that 300 licenses. A lot of the hospitals we've talked to have, 750, 1,000, 1,200 licenses. So while it doesn't help out completely, it does help out for those 300 and getting qualified for that. So the business premium and then that business basic, if you're paying that $6, that can be reduced. Those 300 can be free. And then just some other examples of that pricing. If you've got some of those higher end SKUs, sort of E3, E5, that $32 E3 SKU, having that for $9, and the E5. I also believe that is capped at 300. I need to go confirm for those two SKUs. If there's anybody who has that question about those two SKUs, but some of the other products, the Power BI Pro, again, our data analytics practice uses that. Hopefully some of you are leveraging that technology for, tapping into your health systems to get good data. Those licenses are reduced for that Power BI Pro. And then that Defender security product, which is a great product, for 365, having that be reduced, cut in half there to that 80-cent number. So want to just kind of give you an example of some of that pricing. Just announced last week, Copilot. There is Copilot price discounts that were extended for nonprofits. I believe that went from $30 per user per month down to $25. I'll have to go confirm that, but I do believe there is a small discount now for Copilot for nonprofits as well. So for those of you looking to test out that functionality, that's there as well. Okay, so again, just wanted to list kind of the hospitals that have registered for this and are on that call. All of you do qualify. Gonna get into and Kristen, this sort of like talks directly to these licenses, but that EMS E3 is up to 250 licenses. That's a 12-month term. Again, encouraged to purchase license after 12-month term. We have gone back to Microsoft and said that let's see if we can't extend that for a longer period. New or additional only. So if you have those, in this case, sort of canceling them and re-adding them, this is for net new licenses, and the retail price for those is that $10.60 per month. And then additionally, that 365 E5 security, there's some license requirements that are necessary to get that, but again, up to 250, and that's 12-month term. New additional seat licenses only, and that's $12 per month for that. On the support extension, again, October 14th of 25 is when Windows 10 goes end of life. So for hospitals, that is typically what Microsoft does is after they EOL a product, they do still make support available. We saw this with Windows 7 and back with Windows XP. There is a service that's available for about $60, I think, a year to extend that. But again, you get that extended if that's something that you're not able to get to in that amount of time. So just keep that in the back of your mind if that's something that you're not able to get to prior to that end date a year from now. Those tech assessments I had said are still available. That is something you can reach out. We can, if that's something you're interested in, we can get you more information on how to reach out to those organizations. I am going to jump into, we'll go back to the question slide in a minute. I did prepare sort of direct links to the training that they specifically referred to. So they do have a detailed essential cybersecurity for hospital staff. So this is, if you're required to give training, this is a good training to either draw from or have them complete directly. And it is geared towards, hospital staff, hospital administrator, nurses, et cetera. So there is a link there with that QR code to get directly to that training. And then this is my information. If you want to get a direct copy of my contact information, that is my cell phone. Happy to field any calls, answer any questions about any of this information. What we can do for you is do that license review and leverage our relationship with Microsoft. Again, one of Lutz's, part of our practice, and again, Paul Baumert is on. We do provide accounting CFO services. That's one of the main reasons why we do this is we support over 100 institutions today, and this was just sort of an outreach to say this is something that we really want to make sure we get the word out on and help people through the process. Because again, it's not exactly clear cut, but it's direct savings for institutions that need it and deserve it. So I'm going to go back to my question slide. Reagan is going to make sure that everybody is muted and would be happy to field any questions from anybody else on. So I got to ask John Hall, did John make it on? Or Robert, is that still?
John is out today, and I'm not sure if he did get on here or not.
Oh, okay. Well, he'll get the recording. Please pass along that I was disappointed. I wanted to talk to him about Greencastle and my days at college at DePauw University in Greencastle.
And when did you graduate?
I graduated in '98. Boy, that's a personal question. And I was wanting to know how, Marvin's hamburgers were, if the garlic cheeseburger is still good. And then I was a big fan of Dairy Castle.
Mm-hmm.
Had a penchant for milkshakes. So
Gotcha.
Anyway.
Yeah. My daughter was a DPU computer science graduate in 2009. So small world.
Oh, fantastic. So Dave Burke was still there, I hope.
Yes, I believe so. I heard the
Yeah,
name.
he was an unbelievable professor. So anyway, all right, Brandon, question.
Yeah, so kind of going back to the licensing and as far as the pricing and whatnot. So we had just got accepted for the nonprofit pricing, which is great, and we actually just got our licenses assigned. So that saved us quite, the dollar amount.
That's great.
What we're usually paying, but so that 1 year of the security stuff, is that just for that we only have that a year for? What about the business premium licensing? Is that just for the year 2, or is that set in stone?
No, the good news is so I want to repeat what I heard from you. The nonprofit pricing, you're now qualified as a nonprofit in perpetuity. So if you were qualified as a nonprofit and you got accepted specifically into that nonprofit, there's a whole application process to qualify as a nonprofit. If you qualified, those licenses are good, you're now qualifying as a nonprofit, and those are good in perpetuity. Other existing nonprofits don't have that ability to get those licenses for free for a year. That's only for hospitals. So all of the premium, those specific E3 licenses, any license combination you have that qualifies you for nonprofit pricing, you get to keep that. Those security licenses in particular for any hospital is limited to that $250 for a year. That's something that you'll have to manage. If you'd like to use that, you'll have to figure out then in a year if that is something that you can budget. I don't know off the top of my head if there is nonprofit pricing for those SKUs in particular after those come back. I just pulled the retail pricing. I would have to go figure out what the nonprofit pricing is for those.
Okay.
So yeah, hopefully that answers your question.
Yeah, it did. Thank you very much.
And I have for anybody who is interested, I did produce, it's kind of a slap together PDF, but it lists both of those E5 security features And then the E3 enterprise mobility and security features, it lists both of them kind of side by side and what detailed features come with those. Because I was curious myself. So I'm happy to forward that PDF to you. It's one that I sort of made out of the back of my pickup truck. It's not any official Microsoft documentation. But I did sort of highlight the differences between those two. Joy.
So I'm worried since we were told we didn't qualify because of our relationship with the district, and we already paid. So would they credit us, or would this go for next year?
Great question, Joy. If you can just reach out to me, and here's what I've done for the other 3 hospitals, and this goes for anybody else. So what we've done is we've reached out to our partner and with all these detailed, specific questions, and basically our ability to talk to Microsoft is the value here, to be able to take your specific case and get specific information, directly back from Microsoft to answer those questions in detail, not only about amounts paid, refunds. What we have done is with some hospitals, we've initiated what's called a change of channel. So because we're a Microsoft partner, one of the things that we can do is we can be responsible for your licenses. There's no additional cost because of our relationship with Microsoft. We move it into our tenant, manage it from our partnership perspective, and it would be just licenses only. The benefit you get there is consulting like this, our ability to talk to Microsoft and make sure that your licensing is up to date. So if from a partnership perspective, a lot of it depends on who and how you're buying those licenses. If you'd like more of a deeper relationship and ability to have these types of conversations, we definitely look at entertaining, helping you perform a change of channel, get those discounts, and then ultimately you'd have sort of a phone a friend going forward if you're not getting that from your current partner.
Sounds great. Thank you.
You bet. Any other questions? Reagan is shaking her head no. Well, as promised, I didn't want to take the entire time. I'm happy to have a conversation. We're here to help. Again, this is something that we're doing as a relationship. We've got a strong relationship with the rural healthcare community nationwide, and this is something that we feel strongly about helping. So if there's any way we can help, please give me a call, and I'm happy to provide whatever information we can regarding this program, and hoping to help you save money and protect you from the bad guys. Okay. Hope you guys have a great afternoon.